All right, good evening, everybody. Thanks for joining. We're right at the turn of the hour, so we're going to go ahead and get started. I'll come on camera for just a second so that you can see there are real human beings involved in this live webinar tonight. We're really happy to have Zoetis as a partner here to help us bring this information to you and some race-approved CE so that we can all get that CE credit, even though there's no conferences to go to right now. So hopefully you're snuggled up with a furry loved one or a not so furry loved one. We've had some really cool commentary even from kiddos on this, liking the pets that are on the screen. So if you have a kiddo with you tonight and they think that one of the dogs on the screen is cute, please put that in the chat box, because that has been it's been quite fun to see over the course of the last few weeks with all of us staying in. So my name is Claire Pickens. I'm the Senior Director of Operations for Thrive Affordable Vet Care. We do these seminars so that everybody can get some CE credit while they're sitting at home and learn some things about ticks and fleas, and well, tis the season for that right now. So much requested topic. So I'd like to introduce to you some of the tools that you have available to you tonight. One of the most valuable tools that you have is that chat box. You should know that when you put a question into that chat box, it stays between you and the people that are moderating. We have myself and we have another moderator tonight as well. So we will see that, but the whole group doesn't see your questions. So those stay private and then we answer those throughout. The biggest question that we get with these seminars is, when will my CE certificate arrive? Your CE certificate will arrive to the same email address that you've been getting the confirmations to. That will occur approximately 24 hours after the seminar ends. So the soonest that you would receive your CE certificate would be about tomorrow night at 9 or 10 o'clock Central Time. So keep an eye on that. That's the soonest that it will come. It'll come right to your email box. The email itself is the certificate. So that will have all of the information on it that you need to keep for your records in attendance. And the only people that will receive those are the people that attended tonight. So those are the tools that are available to you. If you are on a cell phone, the cell phone, sometimes you can only see a portion of it unless you swipe to the side. So right now you might only be seeing me. If you swipe to the side, then you'll be able to see the slide that is presented on the screen. So try that out if you're looking at that. Sometimes also with a cell phone, it doesn't always log your attendance as well as a computer does. So if you have any issues with that, or you get an email that says that you didn't attend, please reach out because we can correct that. All right, so I see a few people are already in the chat box. If you wouldn't mind, go ahead and put your state that you're logging in from in there, just so we can practice the use of the chat box and we can see where people are all from around the country. It looks like, ooh, good coverage from around the country. All right, 102 degrees. Goodness sakes, that's too hot. But I'm in Florida, so I can't say much because it's pretty hot here as well. Excellent. Well, thanks for doing that. We've got Iowa, Texas, Kentucky, New York, Arizona, North Carolina, Ohio. Wow, pretty much everywhere around the country. That's fantastic. All right. Well, I'd like to introduce to you our speakers for this evening. You actually have two speakers this evening and a couple of moderators. I'll be moderating any questions you have about certificates and timing and things like that. And we have Dr. Matthew Jerkson from Zoetis that will also be a moderator. He's a major account representative from Zoetis that will be able to moderate the questions that you have about the presentation. And then our two speakers tonight, we have Dr. Rodriguez, board certified parasitologist and field specialist in parasitology for Zoetis Pet Care, received her DVM from Texas A&M in 2009. If you are an A&M fan, go ahead and put that in the chat box. That's good, see the alumni. And then completed an internship in small animal medicine and surgery at the University of Tennessee. Prior to joining Zoetis, she practiced emergency medicine in Houston, Texas, and then completed a concurrent parasitology PhD and residency program under the National Center of Veterinary Parasitology at Texas A&M University. Currently an elected member of the nominating committee and is also a chair for the Electronic Media Committee for the American Association of Veterinary Parasitologists. Would you like to say hello to the crowd tonight, Dr. Rodriguez?
Hi, everybody. Thanks for joining. Excited about talking about ticks, and we'll be talking about ticks all over the country. I was looking at that the chat box and saw that, yeah, you really are. Everybody's calling in from all over the country, so that's exciting.
It is. It looks like we have all the species covered here, or at least we should, right? And all the transients
Yep.
of species as well. And then we also have as your other speaker, and they will be going back and forth, kind of a unique for a webinar to have people go back and forth and share screens. So it's a special treat tonight to have two speakers like this. Your other speaker is Dr. Karen Stasak. I hope I pronounced that right just now. I probably should have confirmed that before we started tonight. She's a veterinary medical lead for biologicals with SCAPULARIS, earned her DVM from Ohio State University, the Ohio State University in 2001, and a master's degree in nursing from the University of Cincinnati in 1994. Prior to joining Zoetis, she was in a private practice for 13 years, owning a mixed animal practice in Colorado, received additional training in comparative animal medicine, and worked at the National Jewish Center for Immunology and Respiratory Medicine in Denver. She's also a neonatal nurse practitioner and worked in the newborn intensive care unit for 20 years. She's currently enrolled in the master's program for clinical microbiology and infectious disease at the University of Edinburgh. So two amazing speakers tonight. Dr. Stasek, would you like to say hello to the crowd?
I would. Thank you very much. And I see my yay, Ohio State in the chat pod. It's always good to have a Buckeye out there. So thank you for that encouragement.
Excellent. Well, everybody take it away, and we'll be in the chat box to help you out when you need.
All right, first I'm going to show the agenda for today. So I'm going to give you all a crash course on tick identification in biology. And then Dr. Karen Stasiak is going to talk about what happens after the tick bites. So lots on diagnosis as well as treatment. Then I will follow that up with death to ticks. So talk about the products that Zoetis offers to prescribe for your patients for tick control. And we'll end it up with the Q&A after that. So, all right, let's kick it off now. So I'm sure, so those of you, I saw in the poll, the majority of people here are veterinarians, but there's a fair amount of people that are technicians and receptionists. So a lot of this support staff. So it looks like about, last time I checked, about 30% are support staff. So I will be referring to vet school. So I'm sorry for those of you who didn't go to vet school, just hear me commiserate with my fellow veterinarians about that. But, or even if you took some classes on tick ID in undergrad, or, even in the practice, learning about ticks, it can be really, ticks can be really intimidating, and it seems like there's so much to know about them. There's keys. You have to look at different shapes and on the tick. And then for those of you who went to vet school, just remember how you have to memorize all the different pathogens they transmit, and then you took the test and it just all went away. So my goal today is just to give you simple methods of tick ID so you won't be intimidated when you take a tick off of a patient in your exam room. My goal is that by the end of this section, you'll be confident in talking to your client about that tick that you pulled off or the tick they brought in, and tell them what concerns are to be about with that tick. So first I want to give a kind of a little comparison between ticks and fleas, because typically, depending on the region where you live, some people may say, well, I don't have ticks, we don't have ticks here, my dog doesn't need tick control, or my cat doesn't need tick control. But that really has to do with the difference in biology, because ticks are everywhere, just like fleas are everywhere. First, we tend to lump these together because we have products that treat both of these parasites, but they're in different classes. Fleas are in the insectid class, ticks are in the arachnid class. Ticks have 8 legs, fleas have 6 legs. They even have different metamorphosis. So fleas have a complex metamorphosis where each life stage looks a lot different from the previous. So think about larva to a pupa to adults. They all look very different. Ticks have a simple metamorphosis. So the larva, nymph, and adults look very similar. They just get bigger and bigger. And also larval ticks have 6 legs, and they gain another pair of legs when they become nymphs. And a big difference is the preference of the number of hosts that they stay on. So for those of you listening on tonight, think about the time when you took an attached tick off of yourself. So if that was an adult tick that was attached to yourself, you pulled it off with tweezers, or maybe you just used your fingers because you just couldn't wait to find tweezers. If it was an adult tick, that tick that you pulled off of yourself, it fed on 2 other animals before it fed on you. And a lot of people don't think that. They think that when they find a tick that's attached on them, they take it off. They think that that's the first thing that tick ever fed on. But in every life stage, each life stage is going to feed on something. So the eggs, when females lay a bunch of eggs, the larvae hatch out, tons of larvae, thousands of larvae. They're super tiny, the size of a pinpoint. They have 6 legs. They are very susceptible to desiccation, so they are going to stay close to the ground and feed on whatever is there. So typically that's going to be rodents, other ground-dwelling mammals, maybe some birds. And that's the first opportunity for ticks to pick up a pathogen. And so typically rodents are a big reservoir for pathogens. So the larva is going to feed on that rodent or whatever else it's feeding on that's crawling around the ground for a few days. And then it's going to drop off and molt into the nymph stage after a few months. So it's bigger now. It has 8 legs now. And that nymph is going to feed on something else, whatever comes by it. It's going to feed for a few days, drop off. And now it's an adult. Adult ticks tend to prefer to feed on larger things that they can get a bigger blood meal out of, because they need a lot of blood. The females need a lot of blood to nourish their eggs. So by the time that adult tick is feeding on you or on your pet, it's fed on 2 other animals and has had 2 opportunities to pick up pathogens. So these ticks spend most of their lifetime off of the host. You should believe owners when they say they don't see ticks. They're hard to spot. They're small. They're in furry animals, right? It's hard to find them on your pet. And they're not living on your dog all the time. They actually live in the environment most of their life, waiting for an animal to come by so they can attach to. So whenever a tick is on a pet, it's only on for a few days and then it drops off. That's different with fleas. Fleas, once they're an adult and they get on a host, they tend to stay there. They don't really have a need to jump off and find another host. Unless they jump on a person, they don't really like human blood, so they can jump on you and feed on you. But eventually they're going to find that cat or that dog that you get next to and jump on them and stay there. So they are obligate to the host. They don't spend, the adult feeding flea does not spend its lifetime or the majority of its time in the environment waiting for an animal to come by. They do that as a newly emerged adult from the pupal stage. But once they're on the pet, they're going to stay there until they die. And for example, if you were to take a feeding flea off of a dog or off of a cat and put it in a little box and kept it in there, that flea is going to be dead within 2 days because they need that constant source of blood meal. So yeah, it's very common for owners to notice the flea problem because those fleas are always on their pet at all times. So that's the big difference between ticks and fleas. And ticks tend to be more stealthy than fleas are. So this is a image of fully engorged female tick. So if you see a dog with an engorged tick on its ear across the room, you can tell your friend next to you that is a female tick, because only female ticks get large and engorged. They're filling up with blood and filling up with eggs. And actually, they synthesize cuticle as they're filling up. So once they're complete their blood meal, they're going to drop off, and then they're going to crawl away and find a safe spot to lay the thousands and thousands of eggs. And once she lays those eggs, she's essentially an empty sack of a tick, and she dies. But she sacrificed herself for thousands of her babies. The male ticks, they don't get large and engorged. They just feed enough to become sexually receptive to the female. And they're only male and female as an adult stage. All right, this is a dog that came into the practice in Oklahoma. We got this from a veterinarian who practiced in Oklahoma. He shared this picture with us. So this dog did not come in for a tick infestation. This dog actually came in for a neuter, right? So this owner was not concerned that all these ticks were on this dog's ear. And this picture is just to remind you that ticks not only cause tick-borne disease, but they also cause irritation to the skin. If there's enough number of ticks, they can also cause a lot of blood loss and anemia. I was at a shelter doing some research when I was a grad student, and one of the veterinarians there told me that they confiscated a bunch of Irish wolfhounds that were covered in ticks, and they had PCVs around 9%, right? And it was all from heavy tick infestations. So besides transmitting tick-borne pathogens, they cause irritation, dermatitis, and even secondary infections in the skin. So I myself had a tick bite on me last fall, and I had a bump that stayed in my skull for like several weeks. So that wasn't fun having to deal with that. Ticks can also be in different areas. This is a tick that was attached to the hard palate of a dog, and this was found during a dental procedure. Right, so they can be in areas where owners may not see them. Veterinarians have told me they have found them in the ear canal, also somewhere in the oral mucosa and the buccal mucosa attached, even attached to right there at the perianal area, right close to the rectum. So they can definitely hide in places where the owners aren't going to see them. And so tickencounter.org is an organization at University of Rhode Island, and they take in tick submissions that you take off of yourself or that you find in the environment, or ticks that you take off of your pets. And one of their grad students reported a study that they did last summer where they found that ticks, they did the statistical calculations. They measured the ticks because they were all submitted in different stages of engorgement. And ticks that were submitted from pets statistically had a higher incidence of being attached for longer. So they had been feeding for a longer period of time when they're attached to a pet versus when they're attached to a person. So people really don't do a good enough job finding these ticks on their pets before they are feeding for a while. Okay, so we're going to go through some common tick species that are important to pets as well as people. First, we're going to go over the AMBLYOMMA genus. And in general, AMBLYOMMA ticks, they have long mouth parts. So AMBLYOMMA ticks are the hardest genus of tick to kill. And so they are dose limiting as far as the product you give. You have to give enough to kill these ticks. And again, those mouth parts are longer than wide. So that's one clue that you're looking at an AMBLYOMMA tick, the longer than wide mouth parts. So these ticks are in the eastern United States mostly. And the female tick, her shield is covering just half of her body because she needs the rest of her body, which is soft and compliant. She needs that body to have room to engorge with blood and eggs. And the female tick has a dot on the posterior margin of that shield. So probably one of the easiest ticks to identify is the Lone Star tick. If you see a dot on a tick, it's a Lone Star tick female. That's all you got to look at. What about the males? So they're a little bit not as easy to identify. Look at the mouth part. It's long. It's probably an AMBLYOMMA. The males, their shields cover their whole body. They have ornamentation on the posterior margin of that shield or that scutum. It kind of looks like a pearly necklace. They also have these little lines here that look like their little shoulders. So that's the female and male tick. They can run. So in particular, Lone Star ticks, they will be on vegetation and questing, passively waiting for something to come by to grab onto. But they will also use cues like carbon dioxide, heat, vibrations, ammonia from urine to run and seek out their host. And researchers use this to their advantage. So if researchers are out there looking for Lone Star ticks, they can either put a piece of cloth on a stick and drag it on vegetation to pick up ticks that way. Or if they're looking for the Lone Star tick, they can put out a tick trap. And this is a rudimentary tick trap. Basically, it's a cut piece of cardboard with tape sticky side up on the edges and dry ice in the middle as a source of carbon dioxide. So they just put it out there and wait for those ticks to come. And this is a tick trap that one of our reps for Zoetis made because he was curious about the Lone Star ticks in his backyard. He lives in Little Rock, Arkansas. So the diseases these ticks carry, the most common pathogen that they carry and transmit is Ehrlichia. So two different species, Ehrlichia chafiensis, Ehrlichia ewingii. In general, with these species of Ehrlichias in dogs, there's going to be a lot of asymptomatic dogs, but they can definitely cause disease as well. And Dr. Stasiak will go over the disease processes. Now, humans also get bit by Lone Star ticks, and they can also get ehrlichiosis. This is the CDC incidence map of human ehrlichiosis in 2018. It has about a 3% mortality rate, which is pretty high. Looking at the incidence map, you can see that there's a really good correlation of human incidence of ehrlichiosis and where the Lone Star tick lives. And we have the highest concentrations in the central U.S. as well as in the mid-Atlantic states. But even in the Northeast, there's a lot of cases there. It's recommended to screen for tick-borne pathogens in dogs, most importantly to understand what their exposure to ticks are. And here, this is from capcvet.org, the map on the bottom right. You can see that the Ehrlichia, as far as the Ehrlichia seroprevalence, looks pretty similar to the human incidence as well as the location of the Lone Star tick. The Ehrlichia in the western U.S. is due to the brown dog tick, so we'll go into that a little bit later. This tick can also transmit tularemia. And for cats, this is one of the most important ticks to cats because it transmits cytozoonphilus, which is the most deadly tick-borne disease to cats in the U.S. So anywhere that this tick lives, there's a potential for cytozoonphilus transmission to cats. There's also been some reports of Rocky Mountain spotted fever transmission with the Lone Star tick, but it's not the primary tick. As some of you may have heard of red meat allergy due to tick bites, and that's because of this tick, the Lone Star tick. There's a carbohydrate in saliva that causes some people to develop antibodies against that carbohydrate, which is also present in red meat. And some people can get, as mild as stomach aches to as severe as anaphylactic shock and hypersensitivity after eating red meat if they have developed these antibodies against it. So very interesting tick. Lots of information here, but biggest take home for Lone Star tick is Ehrlichia. So if you're screening your patients for tick-borne pathogens, and if you're in the Lone Star tick area, and if the dog is positive for Ehrlichia, it's a good chance it's because it was fed on by Lone Star ticks. And then there's that zoonotic potential. So the owners share that environment with their dogs, and they also have that risk of getting bitten by the Lone Star ticks. That our Zoetis rep who set up that tick trap, the following year, he ended up getting diagnosed with ehrlichiosis. He wasn't because he was setting up a tick trap. He was doing some yard work, ended up getting a headache and ended up in ICU and renal failure, and then ended up in ARDS and on medically induced coma on a respirator, all because of tick bite. So it is definitely an under-recognized disease in humans, so people need to be aware of that. They can definitely get very ill from this parasite. Okay, so next tick, AMBLYOMMA maculatum. So this is the second amblyomma I'm going to talk about. Look at those mouth parts. They're longer than wide, amblyomma. You don't see any dots here, right? We're not dealing with a Lone Star tick, but look at the shield. I consider those shields pretty, or the technical term, proper term is ornamented, right? So that female here on the right, her shield is covering half her body. It's a female. She has a very ornamented shield, very pretty. The male also has an ornamented shield. It's also pretty, and his shield is covering his whole body. So these ticks, the common name is the Gulf Coast tick, but as you can see on that map on the top right, these ticks are not just in the Gulf Coast. They used to just be within 100 miles of the Gulf Coast. Now they're more inland. Now they're up the eastern coast. So definitely there's a publication where Gulf Coast ticks were also found in Kentucky. So they have definitely expanded their range. The main pathogen this tick transmits is Hepatozoon americanum. So this is a parasite that affects the musculoskeletal system, pretty severe disease that doesn't have a definitive cure for. And then regarding zoonotic aspect, there have been instances of people getting rickettsia parkeri, or rickettsiosis from bites from this tick. This tick can also cause tick paralysis. So that's typically from a female that's been feeding for a few days that leads to paralytic signs. So here's an image from another rep, but she's a rep for us and lives in College Station. This was in October, and College Station is about a little bit central Texas, about 150 miles to get to Galveston on the Gulf Coast, so quite far from the Gulf Coast. So they were just going on this little walk down a trail, and sure enough, her son found a tick on his sock, and that was a Gulf Coast tick. A Gulf Coast tick that was on him that potentially could have carried rickettsial pathogen, and this is in October, which is typically a time where people tend to think that there's not any ticks around. Okay, next tick species is DERMACENTOR. So DERMACENTOR ticks, they also are pretty, right? So pretty ticks, on the right is a female, her shield's covering half her body. On the left is a male, his shield's covering his whole body. But look at the mouth parts. Remember the Gulf Coast tick, the mouth part was longer than wide. We have short, stubby mouth parts. They're the same length and width. So these are DERMACENTOR ticks. So if you see a pretty tick and it has a short mouth part, it's DERMACENTOR. Pretty easy. And you can see that the range is very wide in the country. So we have our DERMACENTOR variabilis, the American dog tick, and that tick is present pretty much in the whole eastern U.S. as well as on the West Coast. And we have found that with citizen scientists submitting ticks to Oklahoma State with the showusyourticks.org study, the DERMACENTOR variabilis ticks are actually more prevalent in the country, and there were more DERMACENTOR variabilis ticks submitted from the Rocky Mountain states than there were DERMACENTOR andersoni, which is the Rocky Mountain wood tick. So the CDC map is definitely behind with DERMACENTOR variabilis. The American dog tick is present in a lot more areas in the country, in the majority of the country. Really, the most important thing to remember about this tick is that it is the primary tick that transmits rickettsii causing Rocky Mountain spotted fever. And this map is showing you the human incidence of Rocky Mountain spotted fever. It's all over the country, less prevalent in the West, but that doesn't mean it's not prevalent. The pathogen is detected in these ticks in the West, and also another rickettsial pathogen that doesn't have a definitive name yet has also been identified in the West that causes disease in people. And it's called Rocky Mountain spotted fever because it was first identified in the Rockies, but the highest number of cases do occur in the central U.S. and the mid-Atlantic area. Experimentally, this tick can transmit cytozoon felis, but really looking at the cases in the U.S., the Lone Star tick is the primary tick that causes cytozoon felis, the most deadly pathogen to cats. This tick can also transmit tularemia and cause disease, and also animals can get tularemia from ingesting prey, and people can get tularemia from dealing with animal carcasses as well. So another important thing with this tick is that it is the primary genus of DERMACENTOR ticks. DERMACENTOR is a primary genus of tick that causes tick paralysis. So two things, Rocky Mountain spotted fever, tick paralysis are the top two for this tick. It's a pretty tick, short mouth parts, DERMACENTOR. They are very widespread all over the country. And DERMACENTOR variabilis, the American dog tick, they like to be on trail edges, and if that could be even a sidewalk edge. That can be on a chain link fence. There was from chickencounter.org on their website. They showed some videos of when they visited dog parks in Malibu in California, and people kept saying that they found ticks on their dogs after they went to the dog park, and they scanned the whole they scanned all the grass. They didn't find any ticks, and then they looked at the chain link fence, and that's where the ticks were questing. They were coming from the vegetation behind a chain link fence, attaching onto people and onto dogs whenever they came across and rubbed across that fence. And there's a big misconception, too, where people think, well, I'm not going to get ticks unless I go into the woods, go hiking, if I'm around tall grass. But ticks can really be even in your own backyard. But my own personal story about the DERMACENTOR tick, when I was in high school and I was a technician in a vet clinic, my little Chihuahua, she never went outside, but actually she did go outside. She just went into the backyard. So all she did was go into the backyard, a well-manicured backyard with a tree, and she picked up a dermacentor tick in the backyard. I didn't notice until probably a few days later when I was petting her, and then I saw some pus coming out of her neck with an attached tick to it, right? So this dog, and probably a lot of people, and this was in the Houston area, right? So a lot of people think, oh, my dog is in the backyard, not going to get ticks. Well, with dermacentor ticks, the larva, the nymph, they're feeding on other stages, and wildlife, they're feeding on other animals. So wildlife, squirrels, possums, raccoons, birds, they carry these younger stages of these ticks, and they end up dropping in people's yards. And when they come out as adults, they're going to be wanting to feed on bigger things like your pets. Okay, moving on to the next one. I hope you're picking up on some good key information on all these ticks. So for IXODES ticks, these ticks, the females have long mouth parts. This is a female. Her shield is brown, covering half of her body, and her body is a kind of an almond-colored hue to it. Here we have a female tick on the right. Again, there's not much to them. They don't have any ornamentation. The male tick is smaller and he has short mouth parts. So these ticks, the black-legged tick, IXODES scapularis, is present in most of the eastern U.S. Actually, the CDC did update their map with this tick, and it used to not be present in areas like Ohio and Indiana and Illinois. In certain areas in those states it wasn't present, but now we see that it has been detected in the majority of the eastern U.S. And there's also a western black-legged tick, IXODES pacificus. These are probably the most important ticks to humans, especially in the U.S., because they transmit Lyme. And Lyme is the #1 vector-borne pathogen that people will get in the U.S. So we do have 2 species of Lyme in the U.S., but the main one that's transmitted is Borrelia burgdorferi. It has been updated. The name is now Borrelia burgdorferi, just for your awareness, but everyone's going to keep calling it Borrelia burgdorferi. Borrelia mayonii was discovered in the upper Midwest, so now we have 2 different species of ticks that are known to cause Lyme disease in people. Another main pathogen that IXODES ticks transmit is Anaplasma phagocytophilum. Now, there's a lot of pathogens that these ticks transmit to people, right? So this is probably the scariest tick to people in the U.S., so including Powassan virus and relapsing fever. Borrelia miyamotoi can also cause tick paralysis. But in our veterinary community, so with our pets, with our dogs, Borrelia and Anaplasma are the primary pathogens that are of importance with this tick. And big thing with this tick is that the larva stage feeds in the spring and the summertime, and that's the primary stage that is known to transmit Lyme to people because they're small. The nymph stage, not the larva stage. The nymph stage is the primary stage that transmits Lyme to people. They're small. They're about the size of a poppy seed. They feed in the spring and summertime when people are out there in the nice weather, and they tend to not notice them because they're so tiny. But we can't forget about the adult stage. The adult stage of IXODES feeds in the late fall through the winter time. So that is when they feed, and adult IXODES ticks have had 2 opportunities to pick up Lyme and Anaplasma. Once as a larva and once as a nymph. So they tend to have a higher prevalence of Lyme and Anaplasma, and they feed during the wintertime and the late fall whenever people tend to stop using tick control because they think there's not any ticks out there. Okay, so next tick, RHIPICEPHALUS sanguineus. This is a brown dog tick. This is my favorite tick, and I'll tell you why it's my favorite tick, but first let's look at the morphology. It's called the brown dog tick because it's brown and it loves dogs. Pretty simple, right? You see the female here on the right, her shield's covering half her body, and male on the left. This is the first time I'm saying basis capitulum. Some of you may have PTSD from parasitology class. So the basis capitulum of the tick, so the base of where the mouth parts are set on, is a hexagonal shape. So that is a distinguishing characteristic with this tick, and the mouth parts are short, so they're the same length and width. So the brown dog tick loves dogs in that the larva stage, so you see the larva on the bottom left, the nymph on the top right, and the adults, they all prefer to feed on dogs. All the other ticks I've talked about, remember the larval and the nymph stages, they tend to feed on different kinds of animals. and they don't really have a certain preference. But with the brown dog tick, every stage prefers dogs. So that's why this tick is everywhere. It's all over the U.S., all over Mexico and Canada, all over the world, the most widespread tick worldwide, because it lives and is present anywhere that dogs are present. And the reason why this tick can be so widespread is because it is also it's not sensitive to desiccation, to dry environments. So all the other ticks I've talked about before, those ticks, when they're questing, they get dried out when they're on that vegetation. So then during the day, they're going to go down to the ground, they're going to open up their palps and take in water vapor to rehydrate. And they're going to go back up and wait for something to walk by. So brown dog ticks are different. They do just fine in dry environments. They're actually very prevalent in the desert areas, of most common ticks in Arizona, actually. And these are the only tick species that are capable of living and reproducing inside homes. And that's because they prefer to feed on dogs, they're in the home, and they do just fine in dry environments. So tick infestations in the home, it's from the brown dog tick. No other tick can do that. This tick transmits Ehrlichia canis. It's the most pathogenic Ehrlichia to dogs. You can see here, so with this map from capcvet.org, the Ehrlichia star prevalence can be due from Ehrlichia EWINGII chafiensis or Ehrlichia canis. So if you're looking at the Lone Star tick area, it has a higher chance of being from the Lone Star tick. If you're looking at areas where the Lone Star tick doesn't exist, like the Southwest region, if the dog is Ehrlichia positive, more chance of being positive from getting bitten by the brown dog tick. These ticks can also transmit babesia, so very common to see in greyhounds, and it's likely because they live in kennels and tick-infested kennels. Another nickname for this tick is the kennel tick. So in that kind of environment, the pathogens can be transmitted pretty easily between dogs. And the tick also transmits Anaplasma platypus. So if a dog is positive for Anaplasma, it could be because they got bitten by a brown dog tick or from a deer tick, IXODES tick. There was a case of this tick transmitting Rocky Mountain spotted fever, RICKETTSII, for the first time in the U.S. There was a Native American reservation in Arizona, and children were dying of Rocky Mountain spotted fever. The thing is, there were no DERMACENTOR ticks there. So CDC was a little confused. They went over to investigate, and the homes were infested with brown dog ticks. And somehow this pathogen ended up in the dogs and in these ticks. And there were so many ticks that even though they prefer to feed on dogs, they were also feeding on the humans in the house and passing on RICKETTSII. So these ticks also present a zoonotic risk of passing infectious diseases within the household. And I'll tell you that people will tolerate flea-infested homes. When people start seeing ticks crawling up their walls, they get really disturbed by that. And the most disturbing thing is that they didn't see the female laying her eggs that came in with the dog. They didn't see the larvae. They didn't see the nymphs. They finally see the adults. And by then, there's been all these ticks feeding on their dogs, and they had no idea. Okay, last but not least, I'm going to talk about invasive tick, HAEMAPHYSALIS longicornis. So this tick looks very similar to the brown dog tick, but second time I'm saying basis capitulum. The basis capitulum is rectangular, not hexagonal, like in the brown dog tick. And the palps, the mouth parts are short, but the palps are laterally flared. So that's how you can tell the difference. But this tick could be easily confused for the brown dog tick. This tick was first identified in New Jersey a couple of years ago, and since then it's now in 11 states. It's not going away. It's now a new tick that we have. There's no way we're going to get rid of this tick. It is native to Eastern Asia, and it was also introduced into Australia and New Zealand, the Western Pacific Islands. So it's now, endemic there. And it prefers to feed on cattle. There have been incidences of this tick causing a major blood loss in cattle in North Carolina in young bulls. But this tick will feed on pretty much anything. So horses, deer, sheep, birds, dogs, cats, humans, whatever they can get their mouth parts on. An interesting thing about this tick is that they reproduce by parthenogenesis. So the females do not need a mate to lay fertilized eggs. All the ticks that have been collected from the U.S., there's only been a handful of male ticks. All the rest have been females. So we definitely have that strain of this tick that reproduces by parthenogenesis. So it will be really difficult to control this tick. As you can see, this tick is pretty widespread already, not going anywhere. Actually, it is going anywhere. It's going more places in the U.S. Some associated diseases in dogs include Borrelia gibsoni and hepatozone canis in other countries. So far, we have not detected any pathogens in this tick that would be transmitted to dogs in the U.S. There have been some habitat suitability models showing where this tick can become endemic, and the red is showing where 3 models agree. So you can see that actually most of the Lone Star tick area, so the eastern U.S. and the northeastern and also some of the Midwest, is a really good habitat for the longhorn tick. It really does really well in temperate climates, humid climates. The Pacific Northwest and the West Coast would also do really well there. So humidity is a factor, maybe not do so well in drier climates, but this tick has the potential to go a lot of places. And from that student's presentation from tickencounter.org, she did mention that there was a pet owner who submitted a tick he found on his dog in Colorado, and that was a longhorn tick, but he had just come back from the Northeast. He traveled there with his dog and came back. So his dog came with a longhorn tick attached to it. Right, so another reason why ticks are everywhere. People are traveling more with the dogs. We need to keep our pets, dogs and cats, on tick control to minimize tick infestations and potentially minimize a tick getting introduced into a new area. I mentioned before, Oklahoma State has a program called ShowUsYourTicks.org. They actually just had a publication. If you just Google Scholar Show Us Your Ticks, you'll find that publication, really good information they've gotten from tick submissions from the last year. Right now on their website, they are kind of pausing submissions because of COVID-19, but keep an eye on that. You can submit a tick. They'll do a free identification for you. But tickencounter.org is another good resource. And speaking of tickencounter.org, they have these maps called these heat maps, and they have really, really good visuals on showing you that ticks are present year round. So just look at the winter time. This is when people submitted ticks in the winter time to the University of Rhode Island. And the major areas where people live, there's ticks being submitted. And my guess is that in the Northeast and in the Southeast and in the West, everywhere in those areas, a lot of those ticks are EXODES ticks that transmit Lyme and Anaplasma because the adults feed in the wintertime. And also the brown dog tick can be present year-round. There's been home infestations with the brown dog tick in Canada and in Alaska in the wintertime. And they make it in a home, they do just fine in there. Also in the West, DERMACENTOR ticks, DERMACENTOR pacificus, or DERMACENTOR occidentalis ticks, which is another species of tick. They do quest and feed in the wintertime as well. So ticks can be present year-round, and that's why we need to keep pets on tick control year-round. Okay, now Dr. Karen Stasiak, I think I've probably talked a lot longer than I should have about these ticks because they're so exciting, but I'm going to switch this over to you right now.
All right.
Okay.
Pass me and I will get my slides up, and while you're doing that, I will definitely make commentary about your tick pictures. I'm sure I will have nightmares tonight. I'm just guessing about all these tick pictures you All right.
Ticks crawling on walls is definitely a nightmare.
I know. I mean, if I had a tick infestation, I would have to just walk away from my house and just leave it. I'm pretty sure. So hopefully you can see my slides, and you will let me know if otherwise. So I could really spend hours talking about the consequences of tick-borne disease. I'm fascinated by disease, and really in 20 minutes, the big takeaway I want you to have is that tick-borne disease is really bad, but we absolutely have better ways to help prevent it now, which has not always been the case. So we're going to take a little deeper dive here on what happens after the tick bites. All right, I want you to find the tick on this dog. It's not so easy. And many humans diagnosed with Lyme disease have no recollection of having a tick on them. And when my pet owners would tell me I don't see ticks, I absolutely believe them because the ticks are really tiny and this dog is really fuzzy. And so I'm going to zoom in for you here, and maybe you can start to see, here you go. So this tick had at least the common decency to attach in the white part of the fur where we had a chance of seeing it. And this is IXODES. This is the deer tick. And one of the diseases we're concerned about is going to be Borrelia burgdorferi. and we've really learned a lot about the organism Borrelia burgdorferi. Borrelia is a spirochete bacteria. It has an amazing life cycle. It's able to live in two completely different host niches, right? It can live in a tick, it can live in a mammal. You couldn't get any more different than that. And the pathogen does this by changing the type of proteins that are on its outer surface. So when the Borrelia organisms are in an unfed tick, they're going to express outer surface protein A on their bacterial surface. And then when the blood meal comes in after the tick attaches, that temperature change, the pH change, these all signal to Borrelia to start changing its surface proteins so that it's going to start expressing outer surface protein C. And that is going to be what enables that Borrelia to enter the tick salivary glands and cross over into the mammal. And once Borrelia is inside the mammal, it wants to hide, right? It doesn't want to be found by the immune system. And it wants to wait and for the next tick to come along and pick it up to continue that life cycle. So Borrelia is going to change its outer surface proteins again. It's very sneaky that way. And so when we're thinking about Borrelia in the tick, it doesn't matter where you get your tick from, right? You can get your ticks from Rhode Island, where you used to live. You can get them from France. It doesn't matter where you pick up your ticks from. All the Borrelia organisms expressing outer surface protein A all look the same. However, we know there are multiple expressions of outer surface protein C, and we call these outer surface protein C types. And the Borrelia outer surface protein C types that commonly infect dogs are slightly different than the ones that infect humans, and the antibody responses that are going to occur are going to be type specific. And that's really important because that means natural infection from one Borrelia is not going to confer natural immunity. That's going to be long lasting. So for example, take this dog here. This dog's infected with Borrelia expressing outer surface protein type C that's blue. The dog's going to make blue antibodies. If the dog gets bit tomorrow by a tick harboring Borrelia that's expressing outer surface protein C type red, the dog will not have natural immunity to that because he's only got blue antibodies. So this variability in the outer surface protein C types really needs to be taken into account in order to make a broadly protective vaccine in order to address this variability. And that's new science. It's really fundamentally changed our understanding of this disease. Now, the Borrelia down here in the Petri dish at the bottom, I put that there to remind me to talk about in vitro studies. The outer surface proteins that are expressed by Borrelia in Petri dish that are in a vitro study, they're not going to be the same than what's expressed in a mammalian infection. So if you're reading a study and they don't tell you what outer surface protein this Petri dish Borrelia is expressing, the results may not be applicable to a mammalian infection. So we may not be able to extrapolate that data and what it might mean in a mammalian infection or a dog infection or a human infection. So it's just a word of caution about being discriminating when we're reading scientific journals. Now, the most common clinical manifestation we're going to be thinking about, we're thinking about IXODES, and we're going to be thinking about Borrelia, is going to be Lyme arthritis. I'm sure many of you have called in if you have diagnosed patients with this. It's going to be one or more joints affected, fever, lymphadenopathy, but they're going to get rapidly better on antibiotics. Another important manifestation is subclinical arthritis. And these dogs have significant inflammation in their joints, but they are not overtly lame. And so you only know this by doing histopathology on the joint. And you don't have to be a pathologist to read these slides, right? The only thing you need to remember about histopathology is too many purple dots are bad. Right? Those are inflammatory cells. And there are, in this slide, you can see there are vaccinated dogs and unvaccinated dogs. This is a Vanguard Sierra Lyme Challenge study. But you can see here on the left, the dogs vaccinated with Vanguard Sierra Lyme have normal joint histopathology, whereas unvaccinated dogs on the right, they have a ton of inflammatory cells in that joint. And what is really important to know is that not all these dogs were lame. They had subclinical lameness despite all this joint inflammation. And so what does this mean for the client on dog, right? And we don't really know. What does this subclinical arthritis do? Does it set them up for early onset osteoarthritis? Does it set them up for cruciate tears? We don't really know, except that there's been a couple of studies now identifying this subclinical arthritis, and it's really made me personally more committed to preventing Lyme disease in dogs, because I think this is a potential threat to dogs that we just haven't appreciated until now that we've had a couple of studies showing us this. The other manifestation is going to be Lyme nephritis. And Lyme nephritis, it's less common than Lyme arthritis, and you're going to see progressive renal failure associated with immune complex deposition. Now, when we're thinking about IXODES, we're talking about IXODES tick, the other pathogen we're worried about is going to be Anaplasma phagocytophilum. And you're going to start noticing a pattern as we run through these slides. We're going to start being very similar. All right, so Anaplasma phagocytophilum is going to be an intracellular bacteria of the Rickettsiae family, and it's going to infect neutrophils. You can see those when you look under the microscope in the acute phase. Incubation period is going to be 1 to 2 weeks. It's vectored by IXODES, so that means you can get co-infection with Borrelia burgdorferi and Anaplasma phagocytophilum. And the clinical manifestations that we see may be acute, where you have fever, lethargy, anorexia, lameness, musculoskeletal pain, and that looks an awful lot like Borrelia, right? That's why we need to start testing for these. You can get some other symptoms, hepatosplenomegaly, bleeding disorders, some CNS signs, just vague symptoms, vomiting and diarrhea. But those are the primary manifestations that we see with an acute presentation. But you can also get an asymptomatic presentation where you just test positive, but you're unclear of any clinical signs. All right, let's look at this guy. All right, he's got 2 ticks on him. It's really hard to tell what's going on here and what these ticks are. I'm sure Dr. Rodriguez can tell from here. But I'm going to call one of them her favorite tick, RHIPICEPHALUS sanguineus, the brown dog tick, just because I know she likes to talk about that tick. So let's talk about what disease is transmitted in more detail. We're worried about EHRLICHIA canis with the brown dog tick. And similarly, it's an intracellular bacteria of the Rickettsiae family, but instead of infecting neutrophils, it's going to infect monocytes. And the incubation period is going to be very similar, 1 to 3 weeks, vectored by RHIPICEPHALUS, and you can get co-infections with other organisms also vectored by RHIPICEPHALUS. And there's 3 possible clinical stages that occur. You can have an acute manifestation where you're going to have fever, lethargy, anorexia, myalgia. I think you get a little more bleeding epistaxis presentation with EHRLICHIA, but very vague clinical signs similar to the other tick-borne diseases. You can also have a subacute phase where your primary manifestation is thrombocytopenia, and then some dogs go on to a chronic phase. And that's going to be a severe, grave prognosis, right? They get pancytopenia, they get emaciation, and the difficulty here is that it may not develop for years, and not all dogs progress through these stages. So not every dog is going to go to chronic, but not every dog is going to just stay in the acute phase. So there's variability there in how they present. The other organism we're worried about, vectored by the brown dog tick, is going to be Anaplasma platypus. Also intracellular bacteria of the Rickettsiae family, but instead of infecting neutrophils or monocytes, it's going to, as the name implies, infect platelets. Your incubation period is about the same as the others, right? 1 to 2 weeks, vectored by the brown dog tick. So you're going to get co-infections possibly between Anaplasma platypus and EHRLICHIA canis. And the clinical manifestations you're going to see with that is going to be related to the infection in the platelets. So you're going to get thrombocytopenia. You can get some other presentations as well, fever, bleeding disorders, anemia, leukopenia, but primarily thrombocytopenia. Now, this is a tick that I always enjoyed in vet school because it was the one tick that I could pick out on any test thanks to that little white spot. And of course, if you were paying attention when Dr. Rodriguez was talking, this is the Lone Star tick, right? This is AMBLYOMMA americanum. And I like to say this tick vector is what I call fondly the other EHRLICHIAs, right? Not canis, but the other one. And so EHRLICHIA ewingii is going to be similarly intracellular bacteria, going to infect neutrophils. Incubation period is the same, 1 to 3 weeks like the others, and vectored by the Lone Star tick. When we're thinking about clinical manifestations, we're thinking fever, lethargy, anorexia, myalgia, lameness. We're starting to see a lot of these are looking very similar. But we have to consider Ehrlichia chaptiensis. And if you were thinking about this when we were talking with Dr. Rodriguez, you realize this is human Ehrlichia. And it does have a 3% fatality rate. It can be severe. And where the dog goes to pick these things up, so goes the human. So it's really important when you're talking with pet owners about vector-borne disease, and we'll get a little more of this when we're talking about diagnostics, but remembering that this is a human pathogen of severity. All right, this is the pretty tick. Now, if I had to say I had a favorite tick, this would be my tick because it is kind of pretty in a kind of a gross way. So this is American dog tick. This is DERMACENTOR, and you can tell that by the pretty festoons on the tick. And so the thing we're concerned most about is going to be Rocky Mountain spotted fever. So this is intracellular bacteria like the others, but instead of infecting blood cells in the bloodstream, it's going to infect the endothelial cells that line the blood vessels. And that's where you're going to get replication. The incubation period is slightly shorter, and you can have a seasonality to the disease presentation, so March through October. So knowing where you live and knowing if you have this tick, you're going to be, this may be on your radar during that period of time. The clinical manifestations we see are related to the vasculitis. So wherever that occurs, that's where you're going to have your clinical signs. You're going to perhaps have edema in the brain or the lungs, and dogs usually die of cardiac, neurologic, or renal damage. There is some breed predisposition to this as well. But dogs, if you know your area, you know your ticks, and this is on your radar, you can start treatment and have success here. Okay, this is another kind of pretty tick, but he's got a very long mouth, and he moved out of the Gulf Coast. He's not just in the Gulf Coast anymore. And so this is AMBLYOMMA maculatum. This is the Gulf Coast tick. And our big concern with the disease transmitted by AMBLYOMMA maculatum is going to be HEPATOZOON americanum. So this is a protozoal parasite, and the dogs get this by ingesting the tick. So if you remember that slide that Dr. Rodriguez showed, that tick was up in the dog's mouth, that Gulf Coast tick. So the dog was heading for an ingestion of a tick. And the incubation period is going to be 3 to 4 weeks. And the thing we're most worried about here, and the manifestations we're going to see, are the result of pyogranulomatous inflammation. And these dogs they're very painful, severe fever. They get mucopurulent discharge, cachexia, muscle atrophy, and they have a pretty hallmark neutrophilic leukocytosis. And really, I'm going to just run quickly through the diagnostics and treatment here because for myself, I find it very largely unrewarding, right? So the diagnostics are a bit difficult, right? You have muscle biopsy, you can do ELISA, you can do PCR. And treatment, the survival rate can be quite low, 12.5%. You can get up to 84%, but the only way to do that is a combination of a triple therapy and then long-term antiprotozoal medication. And so nobody wants to do that. Nobody wants to have their dog on this. So the best and only thing we can do at this time is to try to kill Gulf Coast ticks, which I know Dr. Rodriguez is going to talk about killing ticks in a little bit. So we're going to move on to diagnostics. And looking at our timeline, there is a sweet spot from the time that the tick attaches until disease is transmitted. So anaplasma and Ehrlichia, as well as Rocky Mountain spotted fever, are quick, right? They're 24 hours or less. So how I remember that, I know the word anaplasma, Rocky Mountain spotted fever, and Ehrlichia spell the word R, and I call that the, are you kidding me? That's really fast. And so that's how I remember it. Borrelia, Babesia, the two B's, and we don't even have time to talk about Babesia tonight, but it's a little bit longer. So 24, 36 hours. If you're talking about Borrelia, you're up to 53 hours for experimental infection in mice. So it's short as well, but not as short as anaplasma and Ehrlichia. So when are we going to see a positive test when we're testing in our practice? Well, anaplasma and Ehrlichia are going to be positive 2 to 4 weeks after the tick bite, and Borrelia is going to be 4 to 6 weeks. So just a little bit longer. But clinical signs for anaplasma and Ehrlichia may precede your positive test, right? That can always be a little frustrating. Like you look at it and you go, the dog has a tick-borne disease, but you test them and it comes back negative. So you may just be in this little area of time where they're showing clinical signs before they test positive. And then certainly we're thinking about Borrelia. It may be months or later, or you may have a subclinical presentation. Now, when we're thinking about testing, we have to think about sensitivity and specificity. And when you're looking at data and interpreting sensitivity and specificity, they have to be compared to a gold standard. And that gold standard is going to change depending on what pathogen you're looking at. And so if a test is highly sensitive and the result is negative, you have confidence the dog does not have the disease. So screening tests should mostly be negative, right? If you're not having all negatives on your screening test, you probably have an outbreak of something, right? So screening tests should mostly be negative. Highly specific test, when positive, tells you an animal has the disease without needing a lot of extra confirmatory tests. So, there's nothing worse than you think a dog has the disease and you test them and you have a positive test and you go, I don't know if I believe that test, right? So that's where specificity comes into play. If it's highly specific and it's positive, you go, yeah, I believe that test. And we also have to think about, what are we testing? There's a difference between antigen versus antibody. And when we're thinking about antigen tests, the best example is going to be heartworm. If you test positive for antigen test on heartworm, you have a heartworm in the body somewhere. Antibody tests are a little bit different, right? It tells you at some point there's been an immune response to the pathogen, right? But it doesn't tell you if you're currently infected or previously infected. It doesn't tell you if you're going to get sick or you've been sick. And this is where it becomes very important, because without routine annual screening, you have no idea when that test turned positive, and it makes treatment decisions far more difficult. Now, I am a huge fan of lateral flow technology. They are highly sensitive, highly specific. They're easy to use. Even I could use them, and I was a terrible technician. They require no refrigeration. And in my practice, if I could get my hands on a lateral flow test, that is what I chose to use. And I recommend having your clients hold these tests while they're waiting for the results. It really gives them partnership in the process. They start sweating all their lack of compliance, but they don't want to tell you about it. And, for many of your clients, this is not going to be the first time they've held a lateral flow test in their hand, hoping that it's negative. And so when it is, you can celebrate with them, like, woohoo, it's negative. But certainly if it's positive, it's an opportunity to have a serious conversation about their exposure to tick-borne disease, because wherever the dog picked it up, the person was probably with them. And it's a huge value add for veterinarians and veterinary technicians to be able to talk about these diseases. This is a picture of the Flex 4, and it picks up all 3 Ehrlichias, including the human Ehrlichia chafiensis, as well as Lyme and two types of anaplasma and heartworm. So now let's talk about what happens when the test is positive. So the first thing we need to ask ourselves, do we have any signs of clinical disease? And if we do, lameness, joint swelling, polyarthritis, protein losing, glomerulonephropathy, I call them symptomatic. And following the most recent ACVIM consensus paper, the recommendation there is going to be to follow UA and UPC, a Quant C6, and do antimicrobial therapy. And although we don't have time to dive deep about antimicrobial therapy, I would refer you guys as open access to go and see. There's a nice table laid out in there for antibiotic choices. Doxycycline is the drug of choice, but there are alternatives in there if you have a patient that cannot take doxycycline. And then certainly you can follow a C6, because remember, these point of care tests are going to remain positive for a while because they're antibody tests. So it's going to take a while for them to revert back. So you're going to need a new baseline for this dog. Bigger concern, right? You've got a positive Lyme test, but they look fine. And so the next recommendation is going to be to follow a UA and urine protein creatinine ratio. If they're spilling protein, the UPC is greater than 0.5, I classify them as positive, and they're going to get a course of antimicrobial therapy. And then following the ACVIM consensus, we're going to repeat their UA and UPC in 2 to 3 weeks, right? You want to make sure we're not missing some other cause for proteinuria in the dog. And then even more difficult is when you have a Lyme positive dog who has no symptoms and is not spilling protein. So what do we do? And there's no consensus on what to do there, other than repeat the urinalysis and the UPC, and plus minus antibiotic therapy. And you have to just know yourself and what you want to do. And for me, what's made my decision in this category is knowing the 2 studies that were done showing subclinical arthritis. I err on the side of treating these guys for their first time positive so that they don't have that going on. Now, Anaplasma ehrlichia, this is the easiest algorithm I've ever made. Okay, if you have a positive Anaplasma or positive ehrlichia, you should get a CBC, and if it's abnormal in any way, I would treat them. If it is normal, well, then we don't really know what to do. You can do either, right? This is where we sort of have a lack of data. You can choose to not treat them, certainly. Some people choose to treat to avoid progression, although I can tell you there's not strong data to do that. We don't know if we treat them in this stage, will they maybe go on to have a progressive disease or not. And so I tend, because of the canis chronic phase, I tend to treat these guys, err on the side of treatment, but there's no data to support that. So you'd be just fine saying, I'm not going to treat them, I'm just going to watch them. Now, anybody that knows me is on this call, they know I don't really like to treat anything. I really prefer to prevent things. That's my goal, is to always prevent disease. It's so much easier. So routine annual screening, hopefully in our discussion, although brief, that we've talked about why we should do this. And, you know, it's really a guide to local prevalence. We know the ticks are on the move. Ticks are changing. Ticks are moving to areas we've never seen them before. Ticks also live in microclimates. I can tell you, I lived in Rhode Island. It was the scariest place to live. It's like Tick Armageddon up there. And I had someone come in, from the University of Rhode Island and flag my yard, so I would know where my microclimate of ticks were in my yard, so I know never to go over in that part of my yard. So if just because you don't have ticks where you live doesn't mean that your pet owners don't have a microclimate where they live. And certainly we talked about a marker for exposure for dogs, but also it's a way for us to evaluate our success. If we're recommending tick control year round and we're doing Lyme vaccines because of where we live, if we're not testing our patients, we have no idea if we're being successful in convincing our owners to be this compliant. And certainly it's a risk for humans. We talked about the zoonosis. All right, the other thing we could do to prevent would be prompt tick removal, which I think we know that that's almost impossible with these fuzzy dogs. And then Lyme vaccination. Annually, OSP A and OSP C variability need to be taken into account. We'll talk a little bit more about that. And year-round ectoparasiticides, hugely important. So when we're talking about vaccination, you know, dogs really deserve the latest innovation. And we're talking about Lyme vaccine. I'm going to talk a little bit about Vanguard CR Lyme. It provides a broad protection for the OSP-C type known to infect dogs. Its chimeric and recombinant technology is going to do that broad protection with low reactivity. It also has a 15-month duration of immunity. And how many vaccines that you would give normally annually would you be okay with a dog being 3 months late? Right, that's what 15 months duration of immunity can do, and is backed by Zoetis Immunization Support Guarantee, which does not require a negative test. I feel like we are in a time of transition thinking about Lyme vaccines. I think back to leptospirosis vaccines, where we started with a 2-way, and then over time we realized we need a 4-way. And now we're in that transition time as well, Lyme vaccines, where we know we need a vaccine that covers for the variability of outer surface protein C. And the inventor of Vanguard CR Lyme is actually a human researcher who, based on his work here on Vanguard CR Lyme, received NIH funding to work to make a human Lyme vaccine, which I am happy to stand in line and be the first person to ever get that vaccine because I am terrified of tick-borne disease. And now I'm so happy to turn it back to Dr. Rodriguez because I want to know how to kill ticks, and that's what she's going to tell us how to do.
Okay. That was excellent. I always learn when I hear from you. Something new.
Thank you. Likewise.
Okay, so since I went overboard on my tick stories, I see that we have about 20 minutes left, so I will make this a little bit quicker than I usually would, so we have time for questions. So this is a Zoetis sponsored webinar, so I'm going to go over the tick control options that Zoetis has to offer to you. So we have Simparica, which many of you are familiar with, and this year we have Simparica Trio. So that has serraline in it, just like Simparica. In addition, it has moxidectin for heartworm prevention and pyrantel 2D worm for hooks and roundworms. So both of these products contain serraline, which is in the isoxazoline class, and drugs in the isoxazoline class have been associated with neurological adverse events. Although they are rare in occurrence, neither of these products have been tested on or evaluated in breeding pregnant or lactating dogs. And the most reported adverse reactions in clinical trials were vomiting and diarrhea. Now, both of these products and all the other isoxazoline products on the label say to use with caution in dogs with a history of seizures. And a lot of people see that and they think, oh, that means I can't use it in dogs with a history of seizures. No, it doesn't. If the label says do not use in, that means do not use in whatever they're telling you not to use it in. But if it says use with caution, you can use it in that scenario. You just have to weigh out the risk and benefit analysis. And for example, in our Simparica clinical field study, which ran for 3 months, there were 4 dogs that were enrolled with a history of seizures and 1 dog that had diagnosed idiopathic epilepsy, and none of those dogs had seizures during that study. So personally, because this is such a great class of products, best in class for fleas and ticks, I would, if I was practicing right now, I would use it in dogs with a history of seizures as long as they were well controlled, right? So just know that is an option. You still are able to use these products in dogs with a history of seizures. And it took time to eventually get enough post-approval neurological adverse events for all of these products where the FDA put out that new warning. So it is rare in occurrence. So the way these products work is that they block chloride ion influx in the GABA-gated channels, so that results in hyperexcitation of ticks and fleas. So I've seen this myself when I gave my dog a Simparica, or gave a dog that had fleas on it. I guess this wasn't really my dog, but within 3 hours I saw a flea at the tip of her fur, and I put it in the palm of my hand. It was, hyperexcited and just going in circles. And I was like, oh well. Simparica starts working on fleas within 3 hours. That's right on the dot. So, yeah, it works really well on fleas and ticks by hyper-exciting them and causing them to die. So with Simparica, the big benefit with Simparica is, one is that the cost benefit. It is the most affordable isoxazoline product out there, but also there is some wiggle room. So we have efficacy against fleas and ticks up to day 35, so that's a week past the month. And we're showing efficacies of anywhere from 96 to 100%. 48 hours, so 2 days after ticks were placed, we have very high efficacy, even on day 35. And the FDA, the minimum requirement that the FDA requires to have a tick species on label is greater than 90% efficacy by 72 hours after tick placement. So we're showing a whole day earlier and close to 100% efficacies, even a week past that month. 4 or 5 different tick species. All the ones that I talked about are the ones that are endemic to the U.S., including AMBLYOMMA maculatum. That's the Gulf Coast tick. And Simparica and Simparica Trio are the only products that have the Gulf Coast tick on the label. So don't forget about that. I picked that was the Gulf Coast tick that I took off of my scalp back in October, November. And the night before, I found one attached to my dog that was dead. And the following morning, I found one attached to my skull that was very much alive. So I like knowing that there's been studies that have shown the high efficacies for the Gulf Coast tick, especially because that's one of the most common ticks that I see where I live down here in South Texas. Okay, so whenever we got Simparica approved, NexGard and Bravecto were already in the market, so we were able to do some head-to-head studies to show how Simparica differentiates itself from these 2 other products. So this first head-to-head study, we were looking at what's the percent efficacy, what's the speed of kill within 24 hours with both of these products. Because before I showed you the 48-hour data, what about 24 hours? And in this study, we fed both Simparica and Bravecto dogs, and that's one thing to keep in mind. So if you're using a product, an isoxazoline, and if on the label it says to give with a meal or give with food, that is for absorption. That is for bioavailability. So make sure you read that label and see if the dogs do need to be given food when they're given their isoxazoline flea and tick oral product. Because if they do, if it says to feed them, it's to increase that bioavailability for that expected efficacy. Simparica, it does not matter, fed or fasted, has the same bioavailability. With Bravecto, you do need to feed with the meal for that increased bioavailability. So in that first month, the Simparica dogs are the dark blue on the left, and the Bravecto dogs are the lighter blue on the right. In that first month, the speed of kill or the efficacy against these Lone Star ticks was very high within 24 hours. So by the end of the month, when Lone Star ticks were placed, 24 hours later, 83% were dead on Simparica dogs and 82% were dead on Bravecto dogs. Pretty good for both of these products. Now, in that second month, so dogs were redosed with Simparica, but they stayed on their initial Bravecto dose. And that's another thing to note. For Bravecto, it does have a Lone Star tick on the label, but it's for 8 weeks. So it works up to 12 weeks. And when you hear that on the commercial, it's up to 12 weeks. That's for the other tick species. But with the Lone Star tick, remember, AMBLYOMMAs are the hardest tick to kill. It is on the label for Bravecto for 8 weeks. So it's not a 12-week product for the Lone Star tick. It's an 8-week product for the Lone Star tick. So that's why we just looked at 8 weeks here in the study. And on the last day of that second month, we saw that 11% of Lone Star ticks were dead within 24 hours with the Bravecto dogs. And with the Simparica dogs, 71% were dead within 24 hours. So we did see a significant difference in that second month, midway through that second month and at the end of that second month, where Simparica killed a lot more Lone Star ticks compared to Bravecto in that 24-hour period. And we did another study comparing Simparica to NexGard with the Lone Star tick, remember, hardest tick to kill, AMBLYOMMAs. Looking at Simparica, we saw very high residual efficacy 24 hours after tick placement. So throughout the whole month, the efficacy started out at 100% on the first day, and on the very last day of the month, when Lone Star ticks were placed on that Simparica dog, 91% were dead. So high residual efficacy at 24 hours. And then with the NexGard dogs, you see that on the light blue bars, that at the beginning of the month, both products worked the same, but at the end of the month, on day 28, 41% of the Lone Star ticks were dead, compared to 91% of the Lone Star ticks dead with Simparica. So we show that even starting at day 7, there's a statistically different speed of kill with these two products, where Simparica definitely shine, showing high residual efficacy. One more study I'll show you, Simparica versus NexGard with the IXODES scapularis tick, the tick that transmits Lyme and Anaplasma. With Simparica, there was consistent efficacy at 24 hours, day 1, 99%, day 29, 96%. With NexGard, again, started out great, but then by mid-month, we're seeing a statistical difference. So starting out at 99%, but then ending up at 71%, and even 77% 3 weeks in. So again, Simparica showed how it differentiated itself from the other products in that speed of kill within 24 hours, killing a higher proportion of ticks within 24 hours. And ideally, you want to kill these ticks sooner than later, right, to try to minimize the transmission or prevent transmission of pathogens. We also did a study showing that Serraline or Simparica did prevent Lyme and Anaplasma transmission from naturally infected ticks. So we collected ticks from a park in Rhode Island, and Dr. Stasiak used to live in Rhode Island, and she told me she knows this park, and I want to make sure never to go to that park. Actually, I'm going to make sure never to step on vegetation when I go into Rhode Island, because I'm terrified of getting Lyme disease. But those ticks were highly parasitized with Borrelia. 57% were parasitized with Borrelia or infected with Borrelia, and 6.7% with Anaplasma. We tend to see that pretty often, where ticks have a higher infection rate of Borrelia compared to Anaplasma. So for time's sake, I'm going to just show you the results. So we had the placebo dogs that we infested with ticks, but didn't give them any Simparica. We did 3 tests to show if they were infected with Lyme. One was an antibody test, one was a PCR test, and one was a culture test. So for the PCR and culture test, we actually took biopsies of where those ticks had attached onto the skin and, extracted DNA for PCR and then put in the culture to see if we could get Borrelia growth to really see if there was evidence that the Borrelia was transmitted from the tick before it died. So high infection rate in the placebo group, up to 7 out of 8 dogs infected. In the second group, these are Simparica dogs that were infested with these highly infected ticks 28 days after getting Simparica. In the second group, they were infected 21 days after getting Simparica with these ticks. And none of these dogs showed any evidence of getting Lyme based on these 3 tests. So that's why we do have a Lyme guarantee for Simparica. So if any dog is on Simparica, has a documented negative Lyme test, and does develop Lyme disease with compliant application of Simparica, Zoetis will contribute up to $2,500 towards diagnostics and treatment for that dog. Now, we also saw, we were running these tests that also tested for anaplasma, and in the placebo group, half of the dogs were antibody positive, and in the Simparica groups, none of the dogs became antibody positive. So although we didn't see a statistical difference between the placebo group and the Simparica group, because remember those ticks they had a pretty low infection rate with anaplasma, we did show that if the dog was infected with these ticks either at day 28 or day 21 after getting Simparica, none of them seroconverted to positive, demonstrating that there was 100% prevention with anaplasma. Now, important to note, this is a small study, and although we did demonstrate the anaplasma was prevented, the transmission was prevented. Remember, back to Dr. Stasiak's portion, anaplasma is one of those faster transmitting pathogens, so within 24 hours. Because of that, and we had really great results here, but we can't guarantee that the anaplasma may not infect the dog if the dog is on an ISOC, sadly, just because of that speed of transmission. But looking at the 24-hour speed of kill with Simparica, I can see why we did have good results here, because we maintained pretty high efficacies with the IXODES ticks all throughout the entire month. So to summarize Simparica, it was the only product that had the Gulf Coast tick. Now Simparica Trio also has the Gulf Coast tick on the label. Starts killing fleas and ticks really fast. Fleas within 3 hours, ticks within 8 hours. And even through day 35, we demonstrate 96% efficacy against fleas within 8 hours after the fleas get on the dog. And then even at day 35, we're showing that 48 hours after ticks get on the dog, 96% of them are going to be dead. And not to mention that even to day 35, that fleas are going to die before they lay eggs and infest the home. So lots of great information there. With Simparica Trio, because it has 3 different ingredients, we wanted to maintain that positive user experience with the palatability and the tablet size and the product cost. So our main goal here was to put out a new heartworm preventative that was not existing before, and to also, in doing so, we're going to address current issues in heartworm, like drug resistance. So that's why we chose moxidectin, which is the most lipophilic, longest half-life macrocyclic lactone heartworm preventative, has the longest residence time, has shown really good data in previous publications using it on known drug resistant strains. So we really upped that dose of moxidectin in Simparica Trio to maximize its effectiveness against known drug-resistant strains the best we could while maintaining safety. We also put pyrantel in the product because hookworms and roundworms are the most important intestinal parasites to dogs. They're the highest prevalence in young dogs, as well as both of them have zoonotic potential. So in trying to have a similar user experience, again, and a reasonable cost, looking at previous studies with Simparica, we saw that we had some wiggle room in the dose of sertraline to put in Simparica Trio. So the formulation of sertraline in Simparica Trio is 1.2 to 2.4 mg per kg, and in Simparica it's 2 to 4 mg per kg. So you can see that there is an overlap there. So the products are the same as far as the weight ranges go. It's the same as in Simparica. Simparica Trio can be given to dogs 8 weeks of age and older, 2.8 pounds to 132 pounds, and above that you want to give the proper combination of tablets. And again, with Simparica Trio, you can give it with or without food. The efficacies are very similar to Simparica. So we're showing data to up to day 28, 29, not day 35, because this is a heartworm preventative as well. You need to give it every month. But here we're showing up to 100% efficacy, anywhere from 90 up to 100%. So still very high efficacies and maintaining that Gulf Coast tick. And even looking at that IXODES scapularis tick, the 24-hour efficacies, very similar to Simparica, where at the beginning it's 99%, at the end it's 94%. With Simparica, it was 96% at the end of the month, with IXODES scapularis ticks at 24 hours. Now, they're not head-to-head studies. We don't have any head-to-head studies, but still these results are promising with how well Simparica Trio works, especially on the IXODES ticks that transmits Lyme and Anaplasma. So that's why we have transferred that Lyme guarantee to Simparica Trio, although because it's a new product, we don't have any post-approval studies yet. So in summary, Simparica Trio also is another product to use for tick control, 5 different tick species, prevents heartworm disease, kills fleas as well, and also treats and controls hookworms and roundworms. So 2 different products we have to offer to you for flea and tick control. And don't forget, it's always tick season. Ticks are always out there. And with that, we will go ahead and take some questions. We have 5 minutes left.
Okay, thank you both, and thank you everybody for who answered questions. The first question I have has to do with, Jessica, I believe your talk in the beginning, and it has to do with, can dogs develop meat allergies, I guess, from a tick bite?
Yeah, so that's a good question. Can dogs develop red meat allergies from getting bitten by the Lone Star tick like people? So right now there's not a lot of evidence there, and it would make sense that they wouldn't, because the ticks that in the saliva there's a carbohydrate called alpha-gal. That's the short name of the carbohydrate, alpha-gal, and that's present in the cell membranes of mammals, except for primates. So it's present in the membranes of mammals or red meat. So dogs have alpha-gal already in their cell membranes. Humans do not. So it shouldn't. There's no evidence. There was one abstract presentation last summer at the World Association for the Advancement of Veterinary Parasitology conference. And basically they just detected alpha-gal and anti-alpha-gal antibodies in a dog, but that's it. So my guess is that that's not an issue in dogs, and it hasn't been shown to be an issue in dogs, and it wouldn't make sense. So if you have a red meat allergy because of a tick bite, you can only eat basically fish and poultry. You can't eat you can't eat pork, you can't eat beef, you can't eat venison, none of that.
Thank you, Jessica. The next question is for Karen. Karen, I think you mentioned in your talk an antimicrobial chart that they can access. Where was that located?
Yeah, so I know we didn't have a lot of time to go into treatment specifically. So the ACVIM consensus update on Lyme borreliosis, if you type some words such as that into Google, it will come up. It's open access. It was done in 2018. And there's a couple of nice tables in there, one for antimicrobial therapy. I mean, doxycycline is going to be the drug of choice. But there are some dogs that aren't able to take that, and so that gives alternatives if you want to do other things. And then certainly there's drugs in there for a drug table for how to treat Lyme nephritis.
Okay, cool. Thank you. Another question for you, Karen, is the abnormal CBC for anaplasmosis or Ehrlichia low platelets, or is there other or more values that they should be looking for?
Yeah, so I say it's any abnormality, any anemia, I call it, right? Anemia, thrombocytopenia, any anemia on the CBC, then that I would consider that abnormal. It's not only thrombocytopenia; it could be any of those. Could be a white blood cell decrease as well. So.
And then continuing on, Karen, Ehrlichia, anaplasmosis, and Lyme are all treated with doxycycline, right? Are there other tick-borne diseases that doxy won't work for?
So right now, doxy works for everything. I always think, gosh, I hope we don't ever get doxycycline resistance, right? Because we use it for everything. We use it for Wolbachia and heartworm. It is our go-to drug. So it is right now the drug of choice across the board. But there are other alternatives, right? So not only for for Lyme, but for Rocky Mountain Spotted Fever. Like there's a few other things we can do. But when we're thinking about Ehrlichia and Anaplasma, I mean, there's not a lot of alternative other than doxycycline, really. So for right now, that would be the drug of choice across the board.
Okay, thank you. Jessica, this question is for you. Can you speak to which tick preventives prevent ticks from latching onto the host versus which preventives don't prevent ticks from latching but prevent them from feeding?
Yeah, so with isoxazoline, so either topically applied or orally given isoxazoline, that, basically we're talking about Simparica, Provecto, NexGard, Credelio, I believe that's all of them, Simparica Trio. Those are all systemically absorbed, and the drug is highly plasma bound, highly protein bound in the blood. So the ticks do have to attach and feed for them to die. Now, products that have repellent activity, those are going to be any product that has permethrin in it or flumethrin. So those are the only ingredients that I can think of at the moment, that have some repellent activity. Now, the thing is, yes, they can repel ticks and prevent them from feeding, but it's not guaranteed. And that's definitely going to be more variable towards the middle and towards the end of these ticks getting onto these dogs after these products have been applied. So definitely ticks can still attach and will still attach and even potentially feed on dogs that have products that do have repellent activity. Where the isoxazolines really shine is that residual efficacy, having that expected and constant source of drug in the blood that's going to give that expected efficacy versus more variability with the topically applied products.
Okay, thank you. And what about whipworms and Simparica Trio?
So Simparica Trio is not labeled for whipworms. We do have an intestinal parasite guarantee. So if a dog is on Simparica Trio and gets the labeled parasites, hookworms or roundworms, or also if that dog gets parasites not on the label, whipworms or tapeworms, Zoetis will back you up and they will pay for that treatment for that dog up to $100. Now, so we get a lot of pushback with that, with Simparica Trio not treating whipworms. But got to take a step back and look at whipworms. So in general, they don't manifest a lot of disease. A lot of it is either not existent or subclinical, although dogs can get severe disease with whipworm infections. That's why we want to do fecal exams every year, right? But in general, whipworms are relatively easy to manage. So if a dog is on Simparica Trio, it's whipworm positive. Typically, they're not going to be showing clinical signs, right? You're doing a fecal was a good job. It shows up whipworm positive. Zoetis pays for treatment. CAPC recommends doing 3 monthly doses to try to control that infection. That dog comes in for its next fecal. So ideally, that's going to be in the next 3 months because you should do a fecal every 6 months. If that dog is whipworm negative, great, let's keep it on Simparica Trio and let's monitor those fecals. If it's whipworm positive again, at that point, it's still on that guarantee. Zoetis will pay to treat for that whipworm infection. And at that point, make a decision. Do you want to keep that dog in Simparica Trio, have that convenience of having all-in-one flea, tick, and heartworm, which other product that does that. And then we'll do quarterly deworming because the whipworms have a 3-month pre-patent period. So we'll just do that to manage that infection. Also talk to the owner about picking up feces. Or at that point, you can say, well, it's been 6 months. Maybe we want to put on something else and something that covers the whipworm. So you may make that decision. But in that case, that owner is going to go back on 2 different products, one for fleas and ticks and one for heartworm.
Okay, thank you. And Jessica, can you comment on Simparica's effectiveness against IXODES pacificus?
Yeah, really good question. So none of the isoxazoline products on the market currently have IXODES pacificus on the label. And so basically to get at the approval, the most common, most widespread ticks were used for that. And it's not a requirement to get IXODES scapularis. So probably most of the drug companies, since they got one IXODES, they just went with that, and it takes time and money to get more species on the label. But going back to the amblyomma ticks, amblyommas are the most difficult genus of tick to kill, knowing that Simparica and Simparica Trio kill both amblyomma, AMERICANUM, and maculatum, I would expect it to have high efficacy against IXODES pacificus, similar to IXODES scapularis.
Thank you. Another question, Jessica, and then we have a couple for Karen. Do you have any recommendations on effective tick medications that are affordable and effective against the American dog tick?
So American dog tick, DERMACENTOR variabilis, that pretty tick with the short mouth part that's pretty widespread around the country. Well, I mean, I am a little biased here, work for Zoetis, but Simparica, I definitely would choose an isoxazoline over topical products for flea and tick control, again, just because of that residual and expected efficacy. And Simparica is the least expensive isoxazoline on the market. And one of the reasons is because it has, it's not a racemic mixture, so giving you bad memories back to organic chemistry. We only have one enantiomer, so the left enantiomer, the S enantiomer, in the product, which is bioactive. So we do stereoselective chemistry, so there's actually less products that go into making Simparica, less materials that go into making it. And also, Zoetis created Ceruliner. We didn't buy it from agrochemical companies, which the two previous products were bought, and so there's royalties to be paid. There's no royalties to be paid with Simparica. We own it all, so we don't have to price it to compensate for that. So I would say Simparica is the most cost-effective isoxazoline out there. And in addition, you can ask your veterinarian about this, or you can look online. There's a Zoetis Pet Care Reward. You can sign up and you get money back every time you buy Simparica, or a lot of other preventative products on a card that you can use at your veterinarian to buy more Simparica or other veterinary services. You can only use it at a veterinarian.
Thank you, Jessica. Karen, I have a few questions for you. The first one is,
Sure.
Would you recommend doing a repeat blood sample if the tick-borne screening test gives a positive result for a tick-borne disease before doing further diagnostics or treatment? And if so, does this apply for all tick-borne diseases?
I mean, there's certainly additional tests you can do, like for EHRLICHIA and ANAPLASMA, you can send PCR. For BORRELIA, I follow the ACVIM consensus, so I'm going to do a little more advanced diagnostics there. If it's positive and the dog is sick, I'm going to, do that urine screening. I'm probably going to send a Quant C6. If they're not sick, I don't appreciate them to be sick, but they're positive, I'm going to do that UA and that UPC, looking for proteinuria to help me make some decision making there. But, it's sort of unlike, heartworm, where you're going to send for a check before you give them imidacide or, some sort of treatment like that. I feel like, you have a little more flexibility when you're talking about the tick-borne diseases as to whether you're just going to gestalt treat them or you're going to do further diagnostics such as a PCR. So I think we have a little more flexibility. I tend to keep it simple and do things I can run in my practice and make my treatment decisions based on that.
Thank you, Karen. Another question for you, Karen. You talked about antigen versus antibody tests. Are you more likely to see clinical signs with a positive result on an antibody or an antigen test?
So when we're thinking about antigen tests, the best example is going to be heartworm. And, if you've seen a dog with heartworm, they may or may not be sick necessarily. So, we can't always say that one test you're definitely going to have symptoms over another. And that's the problem with antibody tests, where antibody tests, if you're not routinely screening them, you don't know when they turn positive. And so given the sometimes subclinical nature or prolonged course that could happen, or the subclinical nature of some of the tick-borne diseases, that's where antibody tests become tricky, especially when talking to pet owners. If you've not tested them before and suddenly they're positive, but they don't look sick, well, what does that mean? And how do you talk to a pet owner about that? And so I think it's knowing that if you're not routinely screening, figure out how you need to incorporate that into your practice. For a lot of people, the barriers were, I don't know what to do with a test when it's positive. What do I do? And so that's sort of where the algorithms can come and help you and your staff figure out, what are we going to do if we have a positive test? That is sometimes a barrier. But then thinking about how you're going to talk to pet owners about a well-looking animal that's testing positive, and what are the possibilities of clinical outcome for that pet, and what does it mean with this test. And so it doesn't necessarily mean one's going to look sicker than the other. It just is going to depend on the individual animal and where they are in their disease course, to know how they're going to develop further.
Okay, thank you. Yes, the last three questions are for you. Although not labeled for it, will Simparica Trio get ear mites and or Demodex?
Good question. So Simparica Trio is a new product. We don't have any post-approval studies yet, like we did with Simparica, that did show efficacy for those, Demodex, scabies, and ear mites. But given the efficacies that Simparica Trio has on fleas and ticks, the similarities with Simparica, I would expect it to work. And if I was practicing and I had Simparica Trio, I wouldn't wait for a study. Knowing how well isoxazolines in general work for these other parasites, I would expect it to work.
Okay, thank you. And do you have any effective treatments that you recommend for treating a yard?
A yard for what?
I assume we're talking about ticks.
Oh, okay. Sorry. Yeah, we are. This is a TikTok, isn't it? Yeah. So I know that you can buy sprays at the store that have tick efficacy. I think there's one that Dr. Dryden at Kansas State talks about. Bayer has a spray that you can buy for ticks. There's also management of your yard where you can cut back some of the vegetation to try to prevent the higher density of ticks. And especially in areas that have a lot of Lyme, there are companies that do that for you, where they come and they manage your yard, make it less tick friendly, and I think not a bad idea also to contact a pesticide company to help you out there. But they can still be out there, but the main goal is to minimize that density.
Okay, cool. And then the last question says, any comparisons with Credelio? I don't know if there's any comments that you wanted to share with that, or I know we talked about two products.
Yeah, so when Simparica came out, Credelio wasn't existing, right? So it was just Bravecto and NexGard. And Credelio was forced to market after Simparica. So it's up to them to do the studies, and they haven't done any studies. So we don't have any studies to talk about. One differentiator as well is Credelio also does require dogs to be given that with a meal for bioavailability. When they're fasted, the bioavailability is around the 20% or so. And when they're fed, it's closer up to the 80% as far as bioavailability. So that's one differentiator there.
Okay.
And again, with Simparica Trio, don't need to be fed. Fed or fasted, doesn't matter.
Cool. Thank you, Jessica. That's all the questions we have for tonight. I want to thank both Jessica and Karen for taking the time and for the talks today and all of the information. And thank you, Claire and Thrive, for sponsoring this and putting this together. We appreciate everybody, joining us, especially late in the evening. And I hope everybody has a great rest of the day or evening, depending on where you're located. And we look forward to seeing you again online sometime.
Yeah, absolutely. All of you that are still on your attendee certificate, I actually pushed up the time on that. So you're going to get that in a couple of hours, and attached to that will be a link to the recording from this evening, as well as the recording will be on thrivevet.com/learning if you want to share that with any of your friends after today. That way you can kind of share this as a staff meeting or whatever you'd like to do, so everybody can kind of get this learning. Of course, the CE is only attached to this live presentation, but at least you can still get the learning from it or go back to parts that you liked the best. So thank you, everybody. Thank you, Zoetis, Matt, everybody tonight, Dr. Rodriguez, Dr. Stasek, for so many great tidbits about ticks. So much to learn on this. So hopefully we can do more of these. All right. Well, if everybody is feeling good, we'll say good night.
Thanks.
Let everybody get back to their TV and hanging out and spending time with their family.
Good night. Thanks for all of you. Thanks for all you being out there and working in this environment. I'm here at my house and not in harm's way, but thanks for being out there and taking care of our pets.
Yeah. Yes. Thanks, you guys. Bye-bye.
Bye-bye.
Bye.